Now like to introduce our next panelist, Mike Witters from the Gray Creek Residents United Against PFAS in Our Wells and Rivers. And I do want to thank Mike for his service both as a fireman and a former military person. After learning his well was contaminated with over 16 PFAS chemicals, Mike Witters set up a community outreach group. He created a Facebook group with over 2,700 members, and he actively goes out in the community to provide information to the community. He's ensuring wells are tested in a rapidly growing area around the Fayetteville Works facility, that's the Chemours facility in North Carolina. He has provided input at all North Carolina Science Advisory Committees since November 2017 to present. He leads teams as they interact with the North Carolina PFAS network, assisting in their research. He actively works with North Carolina State University research teams. He's been working with the North Carolina Department of Environmental Quality, having participated in the granular activated carbon pilot test. He currently has a state PFAS air monitoring station on his property, and he assists the state in gathering information. He has college degrees in information technology and firearms technology. While in the military, he was trained and certified as a Department of Defense hazardous materials handler that would certify loads for shipment by air, land, or sea. He attends the quarterly web seminars that Eurofins conducts to enhance his knowledge and pass it on to the community. He leads presentations to the community, highlighting the area impacted in North Carolina and the rights of the community. He actively engages with state and federal authorities, ensuring violations and spills are documented and action is taken. 2 notices of violation are directly tied to his activities. Thanks, Mike. Your turn.
Okay, good afternoon. I'd like to thank the National Academy of Sciences for this opportunity. I need to thank 2 people, Beth Marcinko and Kathleen Gallagher, that really pushed me in to setting up this community group for the Cumberland County, Bladen, Robinson County, centered around specifically groundwater well waters. The team that I have is listed up on the left of this slide, and Deborah and Chris really are what kept me into this fight. And then I also want to thank Senator Kirk DeVere and Rep. John Zoska, that both bipartisanly are fighting for their constituents. They listen to us, and we work in the concept of one team, one fight for clean, safe water. I also want to thank Dr. Jane Hoppin and Detlef Knapp, who are our heroes in our area as they lead some of the research projects and what they found in our waters. We have 2,644 members plus 19 international members, and we are spread through the entire Cumberland County and Bladen County area. What we found is the impacted wells by the air emissions has expanded from what was thought to be about 10 square miles to 327 square miles. So we had to find out how to reach out to the community. We were finding pockets of people that had no clue that their wells were contaminated or how to get testing. So we reached out and started efforts to do that. One of the things that we have concerns about that we'll get into is we're told that it's perfectly safe to wash our dishes, pans, and the same pans that we cook in. Oddly, at no time has anybody asked me what levels I have in my well. And then the other thing is consumption of food from the garden. That's a big concern to a lot of us within the area. How did we reach out to the community? Well, one of the things that we did is, and Kirk DeVere and John Zoska came to all of our public forums that we put out to the community. We've done protests out to the Chemours facility to bring awareness to the issue and the Gen X contamination that's occurring. One of the things that we found is they would test a well, they'd send a lab report, and the personnel could not understand the lab report. So I basically built the template for the 10 chemicals that are tested under the consent order. There's multiple listed, but they only test for, there's 2 not tested for. So what we did is built a simplified thing to transition it from part per billion to part per trillion. And that's what we did with some of the diagrams. We've had multiple community outreach meetings. We did parades up in the area. And then what we do, we assist the community personnel like Fran Minshew, who, even though she had a granular activated carbon system installed, we were finding that the water was still contaminated. It turns out the hot water heater needed to be purged and the water softener. This is some of the test research projects that we're tied into. Like we said, we are very actively monitored. Brian Long challenged us at the Chemours outreach to watch them. So we did. We watched them, we monitored them, and I caught them on the 1st of June, 38 truckloads of debris from a contamination site by Old Outfall 02 that was dumped in an unlined landfill directly off of a river that feeds into Cape Fear. So they just got a penalty, kind of a joke, $28,000. But you know what? A fine is better than no action at all. Another one that happened was a truck spill. There was Tobermory and Pages Lake Road in September of 2018, right after a hurricane. They had a spill. Chemours reported a day later that it was 1 gallon of rainwater. You can see by this, that is not 1 gallon. And what it came out to be was 11 chemicals with a total of 10,464,000 parts per trillion of 11 chemicals in a concoction. So we reported it, and no notice of violation ever occurred for this. That was concerning to the community. This is what the state will show you, and this is what we show to the community, so they can actually put in their information and see what they are. The study by the human exposure will look at the chemicals on the top left. We know the consent order looks at 12 out of 14. The Genex exposure study looks at 30, and we look, when we test private wells, to 42. So we know the chemicals are there, and we know that it's very important to test for it in blood. I did a very rudimentary scan of the community to find out what types of illnesses. So I had 100 people that responded back to a 2-day survey, and it's not scientific, but this gives us some information that mirrors all 3 sessions before this on the type of illnesses that we're seeing within the area. And so we know that the blood work is required so we can see the correlation of this as the science catch up. We know our fish are contaminated, just like was given in the last session. We know the fish within a mile of the plant are contaminated. More alarmingly is the fish that are 500 yards from the outfall that we, to this date, have not seen test data on. The other thing we know, air emissions, like has been presented. I have an air monitoring station. It collects dry air and wet air, and then basically tells us what has come down within a week. In 2018, this 4,840 was a catch underneath the pine tree. So we know on my property, 4,840 parts per trillion in vegetation. Fran Minshew, and these are upstream, 8,340. So this is from air emissions. The thought that we have that was passed on is most likely the pine needles capture it. The food within 10 miles of this plant was tested, and these are what you were actually seeing in the plants. Some of them exceed the health advisory standards for the 70 parts per trillion on PFOA and PFOS. Interestingly, this mirrors what was in Dordrecht, Netherlands. This is another view of the vegetable data. Now, we actually looked at the water. I give a presentation. My neighbor's well was almost identical, and it's gone up, not down, since the thermal oxidizer. I want to thank Dr. Jane Hopkins for the participation of the 153 people into the Gen X exposure study. We know testing blood right now, whether the science is caught up or not, the baseline right now is very important to us. And we know that the 153, we'll see the blood here shortly, hopefully. We know that in a little bit different than Wilmington, we tested blood, urine, tap water, well water, house dust, and we wore wristbands. And the unique thing in this is that the wristbands did show that we were coming in contact with Gen X for that week that we were wearing it. Now, a lot of people will say that, you shouldn't be concerned of washing your clothes in this. Well, if I'm washing my clothes in water that's contaminated at 3,000 parts per trillion, and no, I do not have a GAC system on my house now, then that means that clothing is contaminated. Very similar to a firefighter's uniform. There are firefighters that are contaminated that have never been around firefighting foam like BLM firefighters. So that's a concern we have. A lot like Lauren stated in the session one, we see a lot of thyroid issues, oddly within horses and cattle and children. So that's alarming. And then this is the N30 blood testing that was done. So the first 30 people, we know that we had high rates of PFAS in the blood. So we know that it's very important that we get the test. In summary, yes, we're very concerned. We think that far more testing needs to be done on a larger portion. And I'm not trying to put off Wilmington. Wilmington has surface water issues. We have air issues. We know it's in our air, our soil, our vegetables, our fish. And we now have discovered, we know there's a plume from a 2016 corrective measures study, but now we know that plume is moving faster than was anticipated off of the facility. Again, I want to thank the Science Advisory Board, NAS, for this opportunity, and all of the other participants, because we mirror exactly what you're saying.
Well, thank you very much, Mike. A lot of really interesting information, some of which I haven't even heard before, including the recent dumping that occurred in North Carolina.